Hello, Facebook friends and family. Thank you again for joining me on our bi-weekly Facebook Live call. I so appreciate you guys being here. I am so thankful for this platform in this day and age where parents can talk to me and y'all can ask me questions and anything that I can do, please let me know. I invite you to join me, to call me. I'll try to get the comments. Hey, Terry, good to see you. Thanks for joining me today. But my name is Dr. Warr. I'm a pediatric dentist from High Point, North Carolina, and I am here to answer questions about your children's teeth. Now, I have to give you a little bit of a disclaimer because today, of course, we're probably going to be talking about the COVID crisis. I know a lot of parents have a lot of questions. We've been open this week for emergencies per the orders of the American Dental Association, the recommendations of the CDC, the American Dental Association, the American Academy of Pediatric Dentistry. We're open for emergencies, for urgent care. We're open to kind of answer any questions that you have. And a lot of the parents, and rightfully so, have been a little bit worried about, well, what are you doing differently? How are you making sure that things are safe? So I'm going to talk about those things today. I want you to know that I'm not the only pediatric dentist that is concerned about you and your children, and of course our staff, and we kind of have to weigh everything and figure out what the best thing to do. But we want to make sure that we are answering your questions about how are we doing new things. And so I want to go over those things again so that you can feel better about doing that. First thing that every pediatric dentist that we're doing at our office is that we're limiting the number of people that come into the office. In other words, instead of seeing maybe 4 patients in an hour, we'll probably only see 3 or maybe 2. It all depends on how we can make sure that we don't have a steady flow of patients in our office. We want to make sure that we maintain the social distancing. And so we're utilizing a different traffic pattern. When you come to the office, we're going to ask you to text or call us so that we'll know that you're here, and then someone will come and get you, or we have a triage table that is set up outside where we're asking questions, we're asking screening questions to make sure that you're healthy, to make sure that your child is healthy, to make sure that you haven't been in contact with anyone who may not be healthy. So we want to make sure that we maintain a contact and a chain of great health, and that helps when you come to the practice. The third thing that we're doing is that we're utilizing an increased awareness of our protective equipment. In the medical field, we call that PPE, or personal protective equipment. So we've upped our game. Not only do we have scrubs now, but we have a coat, a lab coat that goes over our garments that makes sure that if there's any aerosols, because now we know that the COVID is spread by aerosols or by things that happen in the air. And so the coat that we wear is disposable and it's impervious to liquids. In other words, we don't get it on ourselves, which protects us. And also we won't pass it on to your children or to other patients. And so we make sure that we keep those. And the ones that we do reuse, of course, are laundered. And that destroys the COVID virus, coronavirus. So we are making sure that we're covered. We always have been protective. We worn protective equipment for bloodborne pathogens. Every dental office is required to have gloves and masks, and we've upped the type of mask that we use. So the type of mask that we use is a respiratory or a non-rebreather mask. And what that does is it makes sure that we don't breathe in anything. It has a better barrier towards respiratory or airborne viruses and droplets and aerosols and all that kind of thing. And so we don't inhale that because of the type of mask that we're using. We also use face shields now. Kind of makes us look a little bit like an astronaut. And we're going to kind of try to have fun with that with the kids. But we wear face shields now, which also, again, protects us, but it also protects us from spreading it to your child. So those are the things that we're doing to make sure that we up the ante on what we're doing. And I'm going to try to get some of these comments here, and I don't know how to do that, but we'll try to get it. But thank you for joining me. I really appreciate you being here, and I'm going to learn how to work that computer in a second. But we also, the other thing that we're doing, other than we're making sure that no one comes into the office, we're triaging everybody to make sure that we ask them certain questions. We're also making sure that we up our protective equipment. But the other thing that we're doing, I am very excited about a new filtering mechanism that we have at our office. It's called the SAM unit. And what that unit does is it filters all the air. It kind of sucks up all of the aerosols, all of the germs, all of the more than dust mites and everything. And what this machine does, it circulates air at about 700 cubic feet per minute. And what that means is that all of the air that's in that room, it's recycled, and it's also making sure that that air stays pure, not just for us, but also for your child. And yes, Miss Betts, we are accepting new patients. We want to make sure that everyone is safe while we're there in the office so that nothing is transmitted, nothing is going anywhere. So that machine is a SAM 24 unit, and it's working awesome, and it helps us to circulate our air. Remember, the other thing that we're doing is that we are restricting the limit of the traffic that we have in our office, not just the number, but the pattern. Many of you have probably been to grocery stores or to Costco or whatever, and they're asking you to all follow the directions. Well, at our office now, we escort you everywhere that you need to do, everywhere that you need to go. It's kind of like having your own personal dental butler, I'll call it like that. We just want to make sure that your child is safe while they're in the office. And Miss Roberts, thank you. We miss you. We miss all of them. That's probably the biggest thing, is that I miss seeing them. And it's so hard because I can't hug them anymore. So I am absolutely head over heels in love with Ella and Adam and Charlie, and they're some of my favorite. And I hope that next time I see them, I can actually hug them. It's so hard seeing these babies, and I can't hug them. But that's the other thing, of course, that we're doing, the no contact, low contact with all of our precious patients. And they are so sweet. It's the hardest thing in the world not to give a cute little freckle-faced kid a hug. That is so hard. Oh, my God. That's the worst part ever. But I want to thank you guys for joining us. And one last thing, if you have any questions and you don't feel comfortable coming out of the house, remember that we have a 24-hour line that's dedicated just to answering your questions about your child's teeth. Every day a parent will call me and say, oh, it looks kind of like this. And I can, now that with the miracle of technology, I can easily say, hey, send me a picture, or we can do the Zoom call or something like that, which is absolutely secure. And you can send me that picture and we can communicate by email, or I can call you to let you know what's going on. So if you have any questions, you don't have to wait until the governor says that it's okay. You don't have to wait until all the germs are gone, because we know that that's going to be a very difficult thing anyway. But you can actually call me, and through the miracle of what we call teledentistry, I can kind of help you to kind of go through these things. So I hope that I've answered all of your questions. If I didn't, please know. And don't have me in. Yes, that's a social distancing. I like that. I like it. Thank you for that. And please, please keep sending my hugs. Keep sending the questions in if you have them. We want to be here for you even in that. We want to be here for you. We want you to know that we're behind you. We want you to stay healthy. So stay healthy, wear a mask. We're going to require those at the office too. We got to wear a mask and stay inside. Don't not come because your child has a question, but if you have a question, please don't hesitate to give me a call. We appreciate you guys. I miss you guys and we love you guys. Take care. Bye-bye.